Good morning, everyone. This is Dr.Deptee Wariko from Dolphin PG Institute of Biomedical and Natural Sciences. Today's lecture is on tracheostomy. Tracheostomy is basically a procedure in which an incision is done over the trachea so that this artificial opening can give air inside. It assists patient with breathing. Alternative airways, mainly done in ICU patients and patients on ventilators. First, we will discuss about the indications of this technique. First indication is when there is upper airway obstructions, like patients with cancer of larynx and laryngeal edema. Here there is difficulty for the airway passages. Secondly, if the patient is unable to remove respiratory secretions, like patients of coma and respiratory muscle paralysis, here it allows suctioning of these secretions and decrease aspiration of secretions. Thirdly, if patient has respiratory insufficiencies, like in chronic lung diseases, here it decreases respiratory desk spaces and helps the patient for airway pathways. Fourth, prophylactic measures like patients on prolonged ventilations, like where there is a risk of tracheal stenosis, we could use tracheostomy. Fifth, the part of any other procedure can be used to gain access to airways for general anesthesia, or it can be used as precautionary measure in patients who undergo extensive neck surgeries for proper airway clearance. Now, let us discuss about few of the types of tracheostomy. There are various types of tracheostomy depending on the condition of patient and the technique which is intended. Various types of tubes are also used for tracheostomy procedures. So, there could be various types of procedures which are emergency tracheostomy, then elective tracheostomy, then permanent tracheostomy, then we can have percutaneous tracheostomy or mini tracheostomy. On the basis of levels of trachea, we can also have three types of tracheostomies: high level, mid level and low level tracheostomy. We could have different types of tubes like cuff tubes, non-cuff tubes, double lumen tubes, tubes with speaking valves, metallic tubes and so on. Now, the procedure of tracheostomy. It is mainly done under general anesthesia, but in emergency conditions, it could be done with local anesthesia as well. The patient is put in supine position and the neck is extended. For the incision procedure, the neck is properly extended and it starts with skin incision, transverse or longitudinal at neck. Subcutaneous fat is cut. Platysma is cut. Strapped muscles are retracted. If thyroid is accounted, it is displaced up. Blood vessels accounted are cut and ligated properly. Then incision is given on trachea and tube is inserted, preferably through second or third tracheal ring. Skin incision is closed and tracheostomy tube is secured to neck with suturing or straps. Now we move to the care of the patient, which is very important after the procedure. Certain precautions and care is required to ensure proper functioning of technique and to prevent any type of complications. Tracheostomy forces the air to bypass nasal and oral routes, so it is not adequately humidified. This leads to tracheal irritation and secretions increase, which may cause blockage to the tracheal tube at times. So firstly, what we have to do is to educate suctioning of the secretion is very important, which is done properly and regularly throughout. Secondly, humidification of the tube by attaching either humidifier or steam near the patient's bed or attaching some small wet pore gauze onto the tracheal tube to maintain the humidification. See, we can see the gauze is attached. It maintains the humidification of the air. Thirdly, keep the patient under regular supervision so that we can see whether he is properly working, the tube functioning properly or not. Fourth, since it forces the air to bypass vocal cords, patient is not able to speak properly. In such cases, give notepad and bells so that the patient can communicate with you properly. Fifth, if the patient has cuffed tracheal tubes inserted, it should be deflated periodically to decrease pressure on the trachea. However, it may be bad in case of increased secretions or if tube is damaged, infected, occluded or non-functional. Then start a new tube under supervision. All it is invasive, it has too many of complications, so be peculiar about these things. Next is the complications. It has various complications as it is an invasive technique. So first we see the surrounding structures while we perform the tracheostomy damaged during the procedure, which may cause bleeding. Second, tracheal tube may get blocked or dislodged. Third, dry air directly enters the trachea, may cause tracheitis. Fourth, patient may have initially difficulty in breathing with apnea also. Fourth, there may be infection or surgical wounds near trachea or lungs. Next is decannulation. If the patient improves and the medical team suggests that patient no longer needs it, then a trial of decannulation can be used. It is the procedure of removal of tracheal tube and shifting patient back to normal breathing. The tube is occluded for 24 hours. If the patient is able to breathe properly, it is removed. And if the patient feels difficulty in breathing, a small tracheal tube is inserted and initially patient feels better, then we can say that it is okay, but patient has to be watched properly with this small tube also. If he is okay, then we can say that the patient is absolutely fine. Thank you so much.